Hi, this is Dr. Castanet of Back Strong Clinic. I'm going to talk to you today about the use of heat and ice for injuries. When you have an acute injury or flare-up, typically there's an inflammatory component that's largely responsible for the pain. Inflammation is a chemical process that involves a cascade of chemical reactions, and chemical reactions are driven and increased by application of heat. That's why when you have recent onset of pain, you can infer in all likelihood there's an inflammatory component to the pain largely, and that you don't want to use heat on it to drive the chemical reactions, the chemical cascade of reactions that's responsible for the symptoms and signs of inflammation. And those include, think of RSHP. Well, RSVP is the easy way to remember it, except that it's a variant of that. It's RSHP, meaning redness, swelling, heat, and pain. Those are the four components of inflammation and occasionally loss of function. And if you remember from science or you don't, the definition of temperature is average kinetic energy. That means that average kinetic energy, or the movement of the molecules that make up the inflammatory process. So if you apply heat to a chemical cascade of reactions, you will increase the average kinetic energy of those molecules. As they move more, they will combine more, and all of these chemical reactions will be driven and increased, and you will get then more of the symptoms and signs of inflammation, meaning more redness, more swelling, more heat, and more pain. So what you want to do instead is apply ice. You can do ice. Technically, we're supposed to say you can do it for 20 to 30 minutes at a time, take it off for a couple of hours to let the circulation normalize, and then you can do it again. There have been occasions when I've applied ice for hours at a time to an ankle sprain, so you can get away with it. The important thing is you don't want to compromise the circulation too much, so it's probably wise to take it off about every half hour to an hour at most. Monitor the situation, move the limb or the region a little bit, and make sure that you're not impairing the circulation. There are some contraindications to ice, but they're not many, and they don't involve most people. If you have circulatory problems where your circulation is already compromised, then ice can be a problem and can be contraindicated, but that's very seldom the case. That's generally going to be present in older populations with things like stasis pigmentation and swelling in the limbs, things like that. So anyway, that's the way most people should apply heat and ice. Even emergency room physicians will sometimes ill-advise patients about the use of heat. I don't know why that is, except that probably if there's an exacerbation of heat, of the inflammation and the pain, they're not going to be around to see it the second time. The patient will have gone somewhere else to a different emergency room, or more likely to their own primary care doctor or another doctor for treatment. So stay away from heat if you have a recent onset of injury. Use the ice. If you're in doubt, you can call your physician, but those are the general guidelines. I can't be specific for all patients with this advice. It's general advice, but I want you to have an understanding for why you should generally apply ice to inflammation, and why temperature, increasing the average kinetic energy of the chemical reactions, will undeniably drive the inflammatory process and in all likelihood make your pain worse. There's something else I wanted to mention. Yeah, this phenomenon is so interesting, and I've seen it so many times where patients apply heat to a recent onset injury, either on their own guess or because somebody advised them, that when I see people clinically and they tell me their history and I examine them and I observe them, if I see or get a sense that their pain is outsized or more than I would expect given the history of their complaint, then I typically will put that question to them: did you put heat on it? Heat can take a modest problem and turn it into a very severe clinical presentation in the way of pain and incapacity. It can turn a fairly modest problem into an incapacitating one. It might help also to explain inflammation is a process that once you have the acute injury will increase over the course of the next many hours and couple of days, typically reaching its zenith probably a day or two later. And that's when, if you put ice on it, it will often end up just a self-limited problem that gets better on its own, for which you may not need to see anybody. You might also consider taking NSAIDs, an NSAID for that. Not Tylenol, for example, but something like ibuprofen or Aleve or diclofenac or some other anti-inflammatory. As for the anti-inflammatories, they're all in the same class of medications, so taking something over the counter like ibuprofen, if in your experience it helps you, is in all likelihood just as good as taking a prescribed diclofenac or prescription strength ibuprofen. 800 milligrams of ibuprofen or 600 milligrams of ibuprofen prescribed is no different than taking it over the counter in 200 milligram tablets, 3 or 4 at a time. Anyway, so that's the skinny on heat and ice application for inflammation. If I can help you, give me a call, 404-558-4015. I am in Decatur, Georgia. Thank you. Bye-bye.